do this wrong and your blood pressure reading could be dangerously inaccurate. One simple mistake can make the difference between a clean bill of health and a misdiagnosis that leads to unnecessary medications or worse, a heart attack or stroke. There is important information about hypertension, commonly known as high blood pressure, that I didn't want to ignore. Okay? So in this video, I will reveal 12 common blood pressure mistakes that most people make, how they drastically alter your readings, and what you need to do instead. Some of these errors could be costing you years of healthy life. Let us get started. Hello, my name is Nicholas and I appreciate you for always taking your time to watch my videos whenever they pop up on your screen. Feel appreciated. Back to our discussion. Blood pressure is one of the most important health indicators, yet so many people get it wrong. You might be thinking you are safe, but what if your readings are off? Imagine being told you need medication when you don't, or worse, being reassured that everything is fine when in reality you are at risk of a heart attack. The truth is, these 12 mistakes could be leading you to dangerously incorrect readings. By the end of this video, you will know exactly how to measure your blood pressure the right way and avoid mistakes that could put your health at risk. So mistake number 1 is not resting for 5 minutes before measurement. If you've been walking, climbing stairs, or even just rushing to get your blood pressure checked, your reading can be falsely high by up to 12 points. At a health center where I used to work, many patients biked in for their checkups and their numbers were always elevated. So to ensure accuracy, sit quietly for 5 minutes before measuring, okay? Even watching an intense video on your phone could spike your pressure. So relax and breathe before taking a reading. Mistake number 2 is talking during measurements. Talking during a blood pressure check raises reading by up to 7 points. Why? Because speaking affects the relaxation of your blood vessels. Okay? So if you are chatting while the cuff inflates, your readings won't be accurate. This applies at home too. If someone talks to you mid-measurements, your result could be off. Mistake number 3 is choosing the wrong arm. Which arm should you use? Many believe the right arm is correct, but that's not true. Always use the arm with the higher reading. If the difference between your arms is over 10 points, that could be a sign of a vascular disease or a narrowed artery. In that case, consult your doctor. Mistake number 4 is crossing your legs. Did you know that? Sitting with the crossed legs can raise your pressure by up to 15 points. That's a big jump. Your feet should be flat on the floor for an accurate reading. Mistake number 5 is unsupported arm. Your arm should be at heart level when measuring blood pressure. If it is too low, your reading can be falsely high by 7 points. Support your arm with a table or an armrest to keep it stable. Mistake number 6 is no back support. Sitting without back support on an exam table or stool can elevate your blood pressure by up to 11 points. So make sure your back is supported while measuring, okay? Now, let us talk about the biggest mistake, one that could put your life in danger. Mistake number 7 is using the wrong cuff size. If the blood pressure curve is too small, your reading can be artificially high by over 10 points. If it is too large, your reading will be falsely low. This is especially important for people with larger or thinner arms. Check the size of your cuff. It should match your arm circumference. This is one of the most common and most dangerous mistakes. Using the wrong cuff size could mean the difference between proper treatment and a misdiagnosis. Okay? So always check the cuff size. Okay? So let us finish strong. Here are the last 5 mistakes that could be affecting your blood pressure readings. That's mistake number 8. Drinking caffeine before measurement. Caffeine can spike your blood pressure by 10 points or even more. This applies to coffee, energy drinks, and even green tea. If you are sensitive to caffeine, it could be making your blood pressure seem higher than it should be. Okay? A patient I once advised switched to decaf and their blood pressure normalized without extra medication. So they had to leave the coffee. Mistake number 9 is measuring with a full bladder. A full bladder can spike your blood pressure by up to 15 points. So always empty your bladder before taking a reading. Mistake number 10 is white coat and masked hypertension. This is so funny. Some people experience white coat hypertension. By this I mean their blood pressure rises in a doctor's office due to stress, sometimes by up to 30 points or even more. Others have a masked hypertension where their pressure is normal at the doctor's but high at home. That's why it is crucial to take multiple readings at home for a true picture of your blood pressure. Mistake number 11 is not monitoring your blood pressure at home. So if you are managing hypertension or suspect issues, measure your blood pressure 3 times a day for a week before your doctor's visit. That gives your doctor 21 readings to assess rather than relying on a single in-office check. Okay? Mistake number 12 is using uncalibrated or unverified devices. Not all blood pressure monitors are accurate. Wrist monitors tend to be less reliable than upper arm monitors. Even some arm monitors fail accuracy tests. Check the validation of your devices on an official health organization website, okay? Another huge mistake is never calibrating your monitor. Many people use the same device for years without recalibration, leading to incorrect readings. And the biggest mistake that can throw off your blood pressure reading by 30 points or more is not measuring at home regularly. High blood pressure is often called the silent killer because it has no symptoms. So relying only on clinic readings can lead to misdiagnosis and unnecessary medications, or worse, missing life-threatening hypertension. These 12 mistakes can make a huge difference in your blood pressure readings and ultimately your health. Now that you know what to avoid, you are one step closer to accurate result and better health. Which of these mistakes were you making? Let me know in the comments below. If you found this video helpful, hit that like button, share it with someone who needs this information, okay? And also, don't forget to subscribe for more health insights and check out this other video for more information on your health.